Good morning. My name is Brian Weber. I'm with the YMCA, and on behalf of Jim Comerford, our president and CEO, welcome to the Les Chater Family YMCA. Jim is out of town today and couldn't be with us. We're accustomed to hosting announcements like this up at our Flamborough Y, the Y that we often call the Y that Ted built. But today we're here at the Les Chater YMCA, and I thought in 30 seconds I could tell you who Les Chater was. Les lived to be 97 years of age. He was a member of the YMCA for 87 of those years. He was a swimmer, and one day he and I did the math and figured out how much he swam, and we figured he circumnavigated the world, 25,000 miles of swimming. He was a survivor of the prisoner of war experience in Japan during the Second World War, went on to a great career here in Hamilton. And he actually said in his published memoirs that his early training at the Y as a young person was what helped him survive his POW experience. And so, as you would imagine, he was very generous to us, and we asked if we could put his name on a Y, and he said, I had one reservation: putting my name on a YMCA that has a library attached to it gives me pause. What if they mispronounce my name, Les Chater? He would like that I'm retelling that joke. But anyway, a very big YMCA story, almost as big as Ted's story at the Y. And so Ted, welcome back to the Y, and come on up.
Thanks, Brian. It's always fun to be home, I'll tell you. And it's, you know, the YMCA is a special place in many of our hearts. Mine certainly. I was led there as a 4-year-old. I rode my trike down a big hill. I thought it was the biggest hill in the world. And the hill I was told never to ride down. And I was in tears because I couldn't pedal back up. Bay Street Hill, you know, from Hunter, and anyhow, a YMCA staffer came by and helped me out, held my hand, carried my, 3-wheeler back up, spoke to my grandma who gave me hell, and said, little Teddy shouldn't be going up and down these hills. He should, the Y's only 3 blocks away. Why don't I come by and pick him up and take him over? I was 4. I had a lifetime in the Y. Anyhow, so I'll just share that quickly. And we could, by the way, you tell the Les story, we could always use a little less chatter, a little more action, right? And he was clearly into the swim of things, so it was, as you are every single day here, Brian, and thank you so much for your leadership. We have a particular affinity, not just Brian and I, but the Y in our government. And that's another day. We're not here for that. But I just want to kind of reference that. I'm pleased that His Worshipfulness is here as well, and my good friend Quab is here too. So, anyhow, listen, I'm just the facilitator here. I'm not the enchilada that's going to be presenting. So we'll get into that almost immediately. But I do want to say, just by way of backdrop, that I was tremendously excited to be able to convince our government, and Karen's here. Good to see you, Karen. You're doing a great job, by the way. Be able to convince our government to ensure that Hamilton, Brantford was one of the pilot sites. Mr. Mayor, we need to find new ways to do things that create fairer societies for people. But the pros are going to tell you that. Although I do have some affinity with both ministries, given some history, but that's another day too. We need a whole day here, Brian, for that. But that's neither here nor there. So we're going to get an update this morning on the basic income program, and we have many people here who know about it, but we have the 2 people who are living, breathing it every single day, who are exercising great leadership as we move forward in this regard. And I am privileged to work with them every single day. They're wonderful Ontarians who do great work, and I just can't say enough positive about them. If I don't shut up now. We'll go on for another 10 minutes telling you about all their talents, but you don't want to hear that. First of all, Brian, thanks again for welcoming us, as you so frequently have done. And this is beautiful. This is a beautiful, with the hub concept with the library and other things that are going on. It's just everything that we need in communities. Right, Judy? My counselor, Judy Partridge, by the way. And anyhow, so I'm pleased to introduce Minister Peter Vilchin. Peter is the Minister of Housing and responsible for poverty reduction. Now, that's an awesome task, and he does it with his awesomeness. So, Peter, come and share a few words with us, and then you'll take it from there, I understand. Welcome, sir.
Thank you, Ted. Good morning, everybody. Mayor Eisenberger, Councillor Partridge, ladies and gentlemen. It is always a pleasure to be in Hamilton. The mayor and I have often spoken, and I've told him, despite I'm from Toronto, actually Hamilton is kind of my favorite city in Ontario. It's a great city, and it's going to be greater with each passing year. And thank you to Ted McMeekin. I'm actually kind of an old politician because next year I'll be 24 years since I was first elected. But I was a new MPP, and Ted McMeekin kind of took me under his wing and has been very kind to me over the last 3.5 years, and has been a real mentor to me at Queen's Park. And of course, I'm here with my colleague, the Minister of Community Services, Dr. Helena Jonczek, who will also be speaking later this morning. And it's Jonczek because we're Polish, and that is the proper way to pronounce it. So I'd like to also acknowledge some other people who are in attendance here today, key community partners who've been helping us with the pilot project here on the ground, Wesley Urban Ministries, the Social Planning and Research Council of Hamilton, and the Hamilton Roundtable for Poverty Reduction. And I'm delighted you're here with us today. And today we're going to be speaking a little bit more about the basic income pilot and how it is rolling out. Your staff here at the YMCA are also dedicated to empowering people to take charge of their own life and strengthen their community each and every day. And that's what we're trying to do as a government with the Basic Income Pilot. We're testing a pilot to bring more fairness and more opportunity to people in Ontario. We're testing the idea that if you give people a basic income, they'll be able to make ends meet more easily. They'll experience less stress and anxiety, which results in better health and well-being. And they'll be able to take better charge of their lives and make decisions about their future and plan their future better. So that's why we're doing this study. We want to know if there's a better way to support people with low income to reach their full potential rather than the way we've traditionally done things. And the most important step in this process is to get people enrolled in this study and to start measuring the impact of a basic income on their lives and on the life of a community as well. So we're here today to tell you that the Ontario Basic Income Pilot is well underway. And just to give you an update, 400 people from Hamilton, Brantford, Brant County, and Thunder Bay and the surrounding area will receive a basic income payment this month, October. And that's right where we wanted to be. We knew that we would do this methodically, we would do this properly, we would engage communities and individuals, explain the basic income pilot to them, get their informed consent, and get them participating in this. So though we're starting small and enrolling a small number of people, it is ramping up. And we're also making adjustments as we go along the way to ensure that the way that we're approaching people, we're engaging communities, is the most effective way to explain this pilot to them. So as many of you know, we started out by mailing out application packages to random households in Hamilton, Brantford, and Brant County, and Thunder Bay, just to get information out to people, make them aware of the pilot. And then from there, the recruiting process began, and it has been evolving as we gather more information and data. And we've started sharing these application packages to other people in a household that have received them, so not just the first person whose name may have been on the envelope. We've also begun working very closely with community agencies, like some of the ones represented here, to have you assist us and identify individuals in your communities that would be good candidates to participate in the study. And I'm also very pleased that in the coming weeks, we'll be rolling out the next pilot project that's part of the study, which is the one in Lindsay. And I was pleased to be at Lindsay a few weeks ago, and the level of understanding about the pilot and the enthusiasm for it was very heartening, and I'm looking forward to Lindsay beginning to participate in this project as well. So today's an exciting day. We're to get one step closer to learning whether a basic income will be a better way to support those who need it most, allowing them to make ends meet, make decisions about their future, and improve their physical and mental health, and better participate and engage in their community. But the basic income pilot is not the only thing that our government is doing to try and bring more opportunity and fairness to people throughout Ontario. As you know, there is a bill before the House that, if adopted, will increase the minimum wage to $15 an hour by January 1st, 2019, $14 an hour January 1st, 2018. This September, almost 1/3 of all Ontario post-secondary students received free tuition, and many others are benefiting from much fair and generous rules around OSAP and student assistance. And starting January 1st, 2018, all Ontarians of 24 years of age and under will be participating in OHIP Plus, which is free prescription medications for anyone who needs it, with no copayment, no other criteria other than you're an Ontario resident. And that is going to be revolutionary and just another step in our progress to creating a better and fair Ontario. The basic income pilot is another part of that, and I want to thank each and every one of you in this room that's assisting in rolling this out, in engaging with the community, and who'll be participating in the evaluation of how successful it will be in the coming 3 years, and assist us in deciding how we move forward past that. So with that, I'll turn the podium over to my colleague, Dr. Helena Jonchek.
Well, thank you so much, Peter. And first of all, thank you to Brian for hosting us here at the YMCA. And I'll have you know, the first question I asked as I came through the door was, how do I pronounce Les Chater? So it's interesting to hear that story from you. And of course, it's great to be back in Hamilton, and your worship. It's always so excellent for you to come out to these events. I don't think I've ever been in Hamilton without you being there, so thank you so much, and a pleasure to meet Councillor Partridge as well. And of course, my predecessor in this particular portfolio, the Ministry of Community and Social Services, the one and only Ted McMeekin, and as Peter has said, has been kind of a father figure for many of us in the legislature, and great that you're here today, Ted, as well. And just to say to so many of you who came today, who I know are our partners, in trying to help the most vulnerable in our society, because we rely so much on your good works in the community. I was never elected at the municipal level, but I was the medical officer of health for the wonderful region of York for nearly 20 years, so I was an employee of a municipality. And certainly what happens at the ground roots, on the ground, the grassroots know what needs to be done. And I became extremely aware of that through my years as medical officer of health. And of course, having that public health background, I'm firmly committed to the social determinants of health. And as we all know, income is one of those social determinants of health. So it's a privilege to be involved in this project. And of course, we kicked off our first consultation here in Hamilton. Ted, you were there, because of course we wanted to hear how people were feeling about the concept of a basic income pilot, and we got excellent feedback, and that's informed our design of the project and the way that we've been moving forward. And so, as my colleague Peter Milchin has said, we have made significant progress in launching Ontario's Basic Income Pilot. And we knew when we started this pilot that we would need to start slow and learn as we go. And that's why we undertook a staged approach to enrolling people in the study to make sure we're getting things right. We're here today to share some information about next steps in the pilot, as well as about the impressive team that will help advise the government on the study. So first of all, we're pleased to announce that we have formed a Ministers' Advisory Council, which is tasked with providing advice to Minister Milchin and me on the pilot. And we have appointed Susan McIsaac as the chair of the council. And I hope many of you do know that Susan was most recently the president and CEO of United Way, Toronto and York Region, and she brings a wealth of knowledge with over 25 years' experience in the nonprofit sector. It's vital that we draw on the experience of experts in research and evaluation to make sure we're conducting the study properly. And so that's why we've also formed the Research and Evaluation Advisory Committee, which is being led by Dr. Kwame Mackenzie, CEO of the Wellesley Institute and Special Advisor to the Ontario Basic Income Pilot. And Kwame is here with us today, and we're delighted that he is. Dr. Mackenzie is a physician, a psychiatrist, and a director of clinical health equity at the Centre for Addictions and Mental Health in Toronto. He is an international expert on social causes of illness, suicide, and the development of effective, equitable health systems with over 2 decades of experience. And he is an active, funded researcher of social, community, and clinical and policy issues with nearly 200 academic publications. And if you ever want to have a discussion on epidemiological proof of causation, he's your guy. I have a master's in epidemiology, and we've had a few chats on that. So thank you so much, Kwame, and thank you for being here today. And I'm also pleased to announce that we have selected a third-party consortium to lead the evaluation of the pilot. And we followed a competitive procurement process and have now selected a team of researchers led by St. Michael's Hospital in Toronto and McMaster University, obviously here in Hamilton, as the evaluator of the study. The evaluation team will be headed by co-leads, Dr. Stephen Huang at St. Michael's Hospital, Centre for Urban Health Solutions, and Dr. James Dunn at McMaster University, Department of Health, Aging and Society. Dr. Dunn is an international leader in the fields of social epidemiology and health geography, and one of Canada's foremost experts in urban health inequalities. And I'm not sure if Dr. Dunn was able... Oh, excellent. Thank you so much for being here with us, Dr. Dunn. Dr. Stephen Huang is recognized internationally for his research in the field of homelessness, housing, and health, and for his expertise in randomized controlled trials. These are dear to the heart of epidemiologists, randomized controlled trials, survey research, population health, and the social determinants of health. So this evaluation team will finalize the design of the study, gather data and information from participants, and analyze and report back on the impacts of a basic income. So I'm confident that with the team we've put in place, the pilot is being run with the most ethical and highest research and evaluation standards. So I'd like to thank everyone who has helped to get us to here today, and who I know will continue to support us as we move the pilot forward. Thank you so much.
Thank you, Minister Jasek, and again, welcome to the Les Chater Family Y. Minister Milchin, I believe the next step is for the two ministers to take questions from media initially, and then we would open it up to others thereafter. So I would ask the ministers to come back forward.
So, any questions?
Can you tell us how many are actually enrolled from Hamilton? Like, do you break down the numbers that way, or not so much?
On the numbers that I've seen on a weekly basis, it's about 2/3, I think, are from Hamilton, and the 1/3 from Thunder Bay.
And I guess at the beginning of the program, it seemed like there was a little bit of trouble getting people to register or kind of understand what it was all about. How did you kind of overcome that?
Well, I think it's such a new concept for many people, and especially people who are used to, OW or ODSP, or people that actually work or employed and simply have a low income. So we took our time to explain this, answer questions. Many people were concerned, well, what if I sign up to this and I'm worse off than I was before? So you have to reassure people that we do not want anybody to be worse off than they were before. If they change their mind once they become a part of the pilot, they can get out of it immediately. If they were receiving OW or ODSP, they can immediately begin receiving the benefits they previously had. So it was an educational experience, and I think now that more and more people are signed up, the word is out in the community, and we're seeing actually the people that are signing up now. It's a much shorter process to explain it to them because they might already have friends, neighbors that are in it, and it's progressing quite well now.
And we also do now have information sessions led by our team from the ministry that are helping people sort of understand the application process. And I think, as Peter has said, it's more information, sort of reassurance. So we expected it to be kind of a slow. We gave it the summer to pretty much get people informed. We're now engaging also a number of our agencies on the ground as well to help us potentially refer people and give some assistance as well. I thought one interesting stat, just as Peter was talking, is 1/3 of those who have successfully been enrolled are on social assistance. That means 2/3 are actually the working poor. So, and that is much what we expected as well. So my press secretary is happy, so I think we're okay. So we're happy to take more general questions, I guess. So.
Yeah, I was going to ask, so the payments will be going out this month. Is there specific dates? It'll just be throughout the month?
I think it's October 25th. I just happen to remember.
There's a check run every month.
Yeah.
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 Can you go into, sorry, go ahead.
I know that you're probably aware that there's some consternation about garnishment of basic income for anyone who enrolls and has previous debt that can be gone after. I wonder if you could address how you're going to handle that.
So we are looking at what we can do about that. The difficulty is this is a pilot project. It's not established by law that this is an income support program, so it doesn't have the same protections against garnishment that OW, ODSP, and other programs have. Our lawyers are looking into it as to what we can do, but we also want to be very clear with people as they're going through the process of thinking of signing up, of explaining the pros, the cons, and so an individual can make their own decision about whether this is for them.
So that is part of the application process, they're being informed that this is a particular
Yes.
problem?
And it is an informed consent, so this is obviously discussed as part of the application and enrollment process.
Is it still a random pick, or can you actually apply for it?
It's sort of, well, Karen, honestly, why don't you give us the absolute clearest answer on that?
We'll try and do that. We are still doing mail-outs. It is a smaller package that's mailed out, so there is some randomization in terms of that mail-out from the beginning. We don't do as many of those, but as we're working on the ground with our agencies, folks there are just referring, as the minister said, people to us, and we do in-person sessions at selected areas in the cities. And more and more of those will happen, so it's kind of a mix.
So how would somebody apply then?
Well, first of all, they can actually wait for an envelope, obviously. They can call our office, so we do have Apply BI, so there is a website that people could go to. They can give us a call at the 1-800 number, or they could be referred if they're part of an agency that they regularly go to. That agency may be one of our network agencies that will refer them. And going forward, there'll be more public information about these sessions so people can just come in. Okay. Great, thanks everybody.
I was just going to suggest, we have Mayor Eisenberger here with us as he's been introduced, and maybe he wants to share a perspective on this program as well.
Let me just share some thanks, Peter, Minister. This is very important work, and I want to congratulate all the folks that are advocating on behalf of this, Induel and Poverty Roundtable, United Way, all the folks that have been working on getting our poverty issues to the forefront. And recently, as you might know, we approved in Hamilton a $50 million housing strategy over 10 years to help stabilize housing and income supports in that particular area. So worthy of applause for sure. I think this is a unique initiative by a municipality, in fact, and it kind of mirrors the work that you're doing in terms of the basic income. So I'm just delighted you're here, and delighted McMaster is going to be part of the evaluation process. And you know what, hopefully after 3 years, my guess is the evidence will show that this is an improvement on the lives of individuals in our community, which is what this is all about. And when you have a government with a heart, we know that we're heading in the right direction. So thank you for all this great work, and all those that are working in this space. We're all encouraged by the advocates out there that keep pushing us along towards a better Ontario and a better outcome for a lot of people in our community. So thanks to all of those great folks out there, and to you for being here. Thank you. Great success. Thank you, Brian.
I'm told that the ministers need to get back to the legislature, and there may be some time outside for some informal chats if there are further questions. As I listened this morning, I think we've got common ground on a couple of fronts. One is that income is not a barrier to joining the YMCA. Here at this Y, 1 in 2 members receive some level of subsidy, so we don't want income to be a barrier to that. And secondly, we try new things as well, and in the interest of getting better at what we do. And so congratulations to you on trying something different and very unique. And we wish you well, and thank you for coming and joining us here at the YMCA this morning. Thank you all for being with us. Take care.